Hi, can you guys hear me? Oh, yes, you can. Okay, great. Because I was about to hook up my my microphone. Okay, so just as I posted here, I don't know if you guys read the message. So this is a live final exam prep session that I'm doing. This particular session is different than what I normally do with my videos. So this is really just going to be more of a Q&A. I watch so many YouTube videos and, just watch how people do the YouTube live and things like that. So, just kind of excited to try this out for the first time. So, if it works well, then I'll continue this. Okay. So, just as a reminder, our final exam will be 120 questions at 150 points. It is cumulative throughout the entire course. And so sometimes people want to know, well, more questions, with material that was after the midterm or what have you. I'm going to say no. We will have a combination of questions. And so you do have a large question pool. And so everyone will have a different exam. And there's going to be questions, from a variety of different topics. So the best thing is to just definitely study everything. Okay. So for those of you who are on the line joining us, questions. This is a time to just kind of type in whatever your questions are. This can be on any chapters, chapter 1, 2, 4, 7. Even as we move forward and we went into the blood disorder, even if it's anatomy and physiology things, if you need help with that, just let me know. So again, this is just more of a Q&A session. So I didn't feel the need to do an hour and a half review again, like I did yesterday. You guys do have the link for the review that I did on ground. And that I think it was about an hour and a half long. So I didn't want to do that again tonight because you already have a recording for that. But I wanted to at least just dedicate this time so people can have their questions answered. Okay. Okay, so Chelsea has a question. Is diabetes or hypertension the main cause of chronic renal failure? Yes, okay, so that's a good question. When it comes to acute renal failure, they do believe that, according to your textbook, hypertension is one of your risk factors. When it comes to chronic renal failure or chronic kidney disease, okay, whichever one you want to call it, they do believe that diabetes and hypertension, or how can I say, diabetes and or hypertension is, yes, the main cause. So to answer your question, Chelsea, yes. When patients are when patients do have chronic renal failure or chronic kidney disease, keep in mind that underlying long-standing condition that's occurring. Hypertension is one of those. Okay. I don't know what to do about that. Okay, so the reason why it's hypertension and or diabetes is because when patients have diabetes, it's usually a chronic condition, is usually going on for quite some time. Hypertension, the same thing. So the longer those conditions go on, they can lead to other end organ damages, which will lead them into this chronic renal failure situation. So I hope that answers your question, Chelsea. Yes. Okay, so yes to your question. Okay. Sheila, no, you are not going to be tested on the pictures. I know that I kept those in the spreadsheet for, people that want to just kind of, I just kept it there really for people that like to do flashcards and they like to have some sort of image or whatever to match, the topic. So no, you will not be tested on any pictures. And this is another reason why I started doing this YouTube channel, is because I will be using this as a platform to update my videos. I know in my older videos, I did have students in previous terms memorize pictures and more lab values and things like that. So moving forward, now we're not. And again, this is my first time doing this live, so I assume it's recording for me. I don't even know. Let me see, I don't even know who you are, what 7 people are here. But just for the ones that take it, I believe this is being recorded. Okay, again, I'm not quite sure, but I believe it is being recorded. Okay. So again, just as a reminder, and I don't know what sections you guys are in, but the Monday morning class, your final exam is scheduled for Wednesday, January 22nd at 6:45 a.m. And I believe I spoke on that in class, and I'm very concerned about folks getting there on time. Okay. So we are starting exactly at 6:45. So just please make sure you're there at least like, I would say 6:30 to give yourself, some wiggle room there. Okay. Our final exam will be Wednesday, January 22nd at 9. Oh my gosh, I need to pull the schedule up because I'm forgetting now. I think it's 9. Hold on a second. I think it's 9 o'clock or 9:15, something like that. Wait, I have it right here. 9 a.m. Okay, so if you are in the Monday afternoon 12:30 class, our final exam will be Wednesday at 9 a.m. Okay. If you are in the Tuesday evening class, our final exam will be on Wednesday at 11:15 a.m. If you are in the Wednesday evening class for our normal classroom. Okay, we will have laptops for you guys that may need laptops. Okay, so you don't have to worry about that. But if you have your own laptop, please bring it. So we're gonna, utilize that. Another thing too, just to kind of go back to final exam and just kind of in the video that I did or that I recorded yesterday on ground, one suggestion that I would say as far as like preparing for the final exam would be to break down your information. I know, and I don't know where you guys are as far as like how your study habits are for the term, but it is best to not study from the PowerPoint, take that information from the PowerPoint, information from the video, and actually take those topics and just break it down into categories. If you can break down your information in little bits and pieces, it's easier to digest that way, or, just, I would say, easier to memorize. Okay. Another thing that I would suggest, especially when we get to chapters that have a large quantity of information, you can also break those down to like different categories, like acquired disorders, congenital disorders, infections, cancers, even one suggestion that I made, even with GI, because there's so many GI topics. The best way to kind of break that information down is to just break it down organ by organ, so what's going on with the esophageal topics? What are the topics of the stomach? What are the topics in the large intestines? Things like that. So that's my advice that I would say for breaking down that information. Okay. Another advice that I would give you is just make sure you do your check your understanding, the final exam, check your understanding. That kind of gives you a little feel of a practice final. And just keep in mind, and I believe I said this before, once you're done with that and you feel like, oh, you know what, I want to do some more practice questions, feel free to find questions wherever you can. Quizlet, you can get your hands on, especially. So there are NCLEX review books that are just focused on pathophysiology. It is not too early to pick up an NCLEX review book. So I would highly suggest that. Okay. I don't know. Is this mic still working? Can you guys still hear me? Oh, okay. I see a question. Okay, Chelsea. So to clarify my chronic renal failure question, I'm gonna check here next. Yeah, so for the check your understanding, I know that question was I don't think it was correct. Give me 1 second, I'm sorry. I'm sorry, I forgot I had something in the oven. Okay, to answer your question, I know that check your understanding, that particular question was not right with the answer and the delivery of it. For the final exam, I will not get tricky like that. So I'll put it to you this way. For the final exam, you're going to have an option of either hypertension or diabetes. Okay, so it's not going to be both options where you're going to be confused like, oh, okay, well, which one should I choose? Okay. So does that help you, Chelsea? Okay. So but clinically, let me just say this. Clinically, your patient could have both. Okay. So I don't want you to think when you get out in the clinical setting that, oh, okay, well, they're only going to have hypertension, and not diabetes is going to be one of the tests for you to choose the right answer. Okay. All right, Javi, can you clarify ARDS? Okay, so for ARDS, let me see. I don't have very detailed questions with these topics. So just to kind of quickly clarify, ARDS is acute respiratory distress syndrome. IRDS is infant respiratory distress syndrome. When patients have respiratory distress, there's usually some sort of issue with the alveoli not having proper gas exchange taking place, therefore throwing off ventilation that's happening with the patient. Okay, so that's respiratory distress in a nutshell. Now, why is the gas exchange not taking place? The underlying issue is because surfactant is not there, or there's not enough surfactant, okay, to actually support the alveoli so the alveoli can do their job. Okay, so in both cases, there's basically a disruption of the alveoli. Now, what causes it, or to say the risk factors are different from an adult as opposed to a child. I do want you to understand, in order for it has to take place, So that underlying condition could be many things, especially heart failure or heart attack. Sorry, just saying it's reconnected. Okay. Whatever the underlying issue is, whatever the case may be, there's going to be some sort of issue where there's possibly a lack of blood flow getting to the lungs that's actually going to destroy or cause some disruption in the alveoli, gas exchange not taking place, and then now here we go, they're in a respiratory distress. Okay, so that's the adult version. The infant version is also going to be an issue with surfactant as well, or issues with the alveoli. This usually comes from the mom not having proper prenatal care. Mom is diabetic, so maybe the baby actually was born, early and has a low birth weight. Okay, low birth weight, or the baby is not fully developed. Okay, in the sense where now it's going to have a lack of surfactant. Okay, that's happening, or destroying the surfactant. Basically, the baby's not having enough surfactant to support the alveoli, which will put them into not a little bit with the description. And what I just explained to you is just where I'm going to go with it. I know in the PowerPoint, there was a little more information as far as signs and symptoms and things like that. I'm not going to have questions on the signs and symptoms. I just want you to have just a basic understanding of what those two topics are. So Javi, just let me know if that helps. Oh, JB. I'm so bad. I know faces, but I don't know the names. Okay, so any other questions? So I know there's some people that are just joining in. For those of you who are just joining in, this is a little different setup in a sense where, as you can see, I'm live, and we are basically doing a Q&A session. So I had, recorded videos already on the final exam, so I didn't feel that it would be, worth it to do another 1.5-hour video that I did yesterday. So I think this is a time to kind of focus on any particular questions that you may have to get ready for the final exam. So, and I can see it, and we can get your questions answered. Okay, so while we're with YouTube, does this work for you? And again, I'm just doing a Q&A session for the live. As far as moving forward with the videos for next term, for those people, I'll probably just do it a different recording for that, or a different setup. I don't know if I'll do it live, but we'll see. Okay, everyone's kind of quiet. Do you guys have any additional questions? Can you guys hear me? Okay, so if there's no more questions, I'm actually going to stop this live streaming. And like I said, I believe this is being recorded. So for those people that weren't able to join in, they can just kind of hear it, you know, later. If you guys have any questions between now and the final exam, don't hesitate to email me. And I will be around this weekend. I'll be on campus. I don't know if I'm going to be there Tuesday. I may be there Tuesday. Monday's a holiday. So if anyone needs, you know, to see me or sit down and meet with me, I can be available on Tuesday. So just shoot me an email and just let me know topics again. But just what are your particular questions? So if there are no more questions, I'm going to end this live streaming, and I hope this helped you guys. Again, if you have any questions, just feel free to email me. Okay. Have a good night. Oh, also, I'm sorry, before everyone leaves, I think people are still here. I think it helps if you can just type in if you like the live session, or I think give it the thumbs up or what have you. You can also subscribe to the channel so that way you can get additional information even if you are moving forward into nurse